Hello everyone. Today we will talk about Mental Health Act 2014. Our group presentation is going to include 4 parts: introduction, 3 compulsory treatment orders, nurse role and responsibility, recommendation, and summary. Mental Health Act 2014 is commenced on the 1st of July in 2014. This measure placing people with a mental illness at the center of their treatment, care, and recovery. The purpose of it is support and assist patients with mental illness undergoing mandatory treatment to make regional judgments and decisions about their treatment, their assessment, and determine the individual path to recovery. Besides, ethical principle is also a foundation of care of patients who with mental health condition. Ethics usually based on 4 aspects of bioethical: autonomy, non-maleficence, beneficence, and justice. The next thing I want to mention is when patients go to meet practitioners, there will be voluntary treatment and involuntary treatment. The voluntary treatment is patient receive the normal treatment process. The involuntary treatment means patient need to receive compulsory treatment. And there are 3 kinds of compulsory treatment order. The first one is the assessment order that enables an authorized psychiatrist to examine the person without the person's consent to determine whether the person have mental health illness and need compulsory treatment. If the person meets all the criteria of assessment order, the psychiatrist will make an assessment order. Assessment order can be made by a registered medical practitioner or a mental health practitioner within 24 hours. And in the assessment order must indicate where the person is going to be undertaken, hospital or community. If treated in hospital, the person must be taken to and received at the designated mental health service within 72 hours.
Hello everyone, I will interpret the second stage of compulsory treatment. It's a temporary treatment order. It only can be made by an authorized psychiatrist, and it provides a compulsory treatment to the person immediately, and also it enables the person to be taken to and to stay and be received at treatment in a designated mental health service. Or it can be treated in the community. The temporary treatment order only can be made when the person met all of the criteria of this order. It includes the person has mental illness, and because of mental illness, the person needs immediate treatment to prevent the serious deterioration in the patient's mental and physical health, to prevent the serious harm to themselves and others. And there are no less restrictive ways for the person to get immediate treatment. The duration of the temporary treatment order is up to 28 days. So after 28 days, it will expire. When the psychiatrist thinks the patient still need to continue treatment, the psychiatrist will apply a file to the mental health tribunal for a treatment order. So the treatment order is the third stage of compulsory treatment. The treatment order only can be made by mental health tribunal, and when the mental health tribunal gets this file, and they need to conduct a hearing within 28 days to determine whether the person needs continuously compulsory treatment. The criteria of the treatment order and is similar to the criteria of temporary treatment order. And the duration of treatment order is depending where the treatment is be taken. If it will take in inpatient, the duration of it is up to 6 months. If it will take in the community, the duration of it is up to 12 months. They all for the adults, but for the people who under 18-year-old age, the duration of it is up to 3 months, no matter inpatient or outpatient.
Person-centered care was considered as one of the key elements in nursing care. Our nurses should always put the patient in the first place and ensure their safety. We also need to consider our clients' demands and preferences within healthcare plan. Therefore, it is important to promote patients take part into health practice. There are a few ways can make our clients get involved. The first one is to let the patient have a conversation with our health professionals. This will show nurses respect for patients' medical knowledge, and from that, we will know their routine for using medications. This would also allow patients to have their rights to make their preference about the activities. Secondly, nurses could share some brief medical knowledge, such as vital signs and so on. So nurses were able to find out the patient's current condition through dialogue, and the safe care can be maintained. Thirdly, nurses also can share part of their care plan with patient before and after the procedure was done, so they would have a chance to know what is going to occur. And finally, we would monitor patients to self-administer medication without nurses' assistance, thus to ensure they are using devices correctly. However, the application of person-centered care was quite opposite with restrictive practice. We are not only needed to provide person-centered care to patients with mental conditions, but also should take responsibilities for all consumers. At this time, we need to keep balance between those roles and always take safety issue as a priority. In order to decrease the occurrence of unexpected injuries and reduce the use of restrictive interventions in mental health settings, trauma-informed care and sensory modulation approaches can effectively reduce the rate of using restrictive interventions. Sensory modulation provides clients with assessing a range of sensory modalities in a suitable procedures and aiming to help them to relieve their negative emotion issues. Trauma-informed care is a framework for identifying both physical and psychological traumas that may cause mental health problems on a person. These two strategies are beneficial for both patients and our nurses, which can reduce the use of seclusion and the risk of further trauma happened during the delivery of mental health care, such as post-traumatic stress and other stress disorders. These strategies allow for a convenient way to apply treatment and lower barriers to keep patients from reaching health care. As a result, the consumers would have the opportunity to discuss what could be done during their treatment so they can make a choice and avoid seclusions or restraint.
From today's presentation, you probably have some basic knowledge about the Victorian Mental Health Act 2014. I hope this will help with your mental health nursing career in the future. Let me just summarize what this tutorial has discussed about, and then we can go further with the short Q&As. From the beginning, Dr. Zhou and Counselor Liu provide details about Mental Health Act 2014. It can be summarized as a framework intended to promote recovery-oriented practice, minimize compulsory treatment, and support as well as protect the rights of people living with mental illness. This act can ensure patients' independence and they are able to receive least restrictive options. Additionally, patients can feel empowered and involved. They will also feel respected during the treatment. And Dr. Sun talked about the importance of patient-centered care in the nursing practice and the two approaches to reduce the restrictive interventions in the mental health setting, which are trauma-informed care and sensory modulation. At the very last moment, you must be thinking about, as a nurse, how can we embrace this mental health legislation in the future career? Let me give you some suggestions. To ensure patients' integrity, we can acknowledge their rights to them. For example, we can have a conversation to verbally tell them that they have rights to discuss options and flexibly adjust their treatment preferences. In addition, patients are responsible for documenting appropriately and accurately. Furthermore, we can promote the collaborative relationship with both health practitioners and our patients. At last, we can ensure the quality of our health services and the accessibility to our patients. Thanks for watching.